Welcome, audience, for Dr. KK Med Talk Show, episode number 375. The great collaboration between IJCP, Heart Care Foundation of India, and USP. We have gone through a good series on doxycycline. We have discussed about antibacterial action of doxycycline, anti-inflammatory action. We have seen the doxycycline role in malaria, dengue fever, as well as febrile illness. And today, one more step we are going to discuss is the role of doxycycline in acne and inflammatory disease, especially which are related to the skin. And for this particular bed talk, we have got Dr. Devendra Jain, a consultant dermatologist from Mumbai, working in Vasai and Virar area. He has done his graduation as well as post-graduation at one of the most important reputed institute internationally also, that is GS Medical College and KM Hospital. He's a very patient-friendly doctor. If you look at his ratings on the digital platform, patients are liking his all procedures. He's set up his specialized clinic in not only clinical dermatology, but also in special interest in aesthetics as well as lasers. And he is a vivid traveler. He has got a great hobby of trekking across the globe, and also has got a rich knowledge in philosophy. So welcome, Dr. Devendra Jain.
Thank you.
Yeah.
Thank you. Namaste.
Namaste. So we'll start discussing about acne. I think one of the very important disorder, which is not only physically debilitating, also I think it is emotionally debilitating. Now, in your practice, sir, what are the different acne lesions you come across?
See, basically, acne is an inflammatory process of pilosebaceous unit, and different type of lesions are like whiteheads and blackheads, which are also known as comedones, closed comedones, and these are known as whiteheads, and open comedones are known as blackheads. Then you have papules and pustules, which are also known as inflammatory lesions. So, and then you have nodules and cysts, and sometimes even these cysts, they join together and they form large sinuses. So accordingly, you can even classify the acne as mild acne, moderate acne, and severe form of acne. Mild acne is where you have more of comedones, that is whiteheads and blackheads. Then few lesions may be papulars or maybe pustule lesions. When you have moderate acne, then you have more of inflammatory lesions along with comedones. That is moderate acne. And severe acne, obviously, you have cysts and nodules, and along with that, tendency of scarring. So these are the type of lesions we see in acne.
Yeah, I think each and every patient, these lesions vary from time to time.
Yes.
And you may be coming across mild, moderate, severe acne in the same patient at variety of time. Now, one of the reason for that is like risk factors, right? One, obviously, the acne is a feature of coming into puberty at the age of 14, 15, 16, no doubt, for everybody. But what are the specific risk factors where the people have to be careful? What are the risk factors which predispose to acne?
See, mostly it is because of the androgens. So when you are from childhood coming to teenage, the androgens, they start secreted in your body, and that leads to changes in the pilosebaceous unit, and secretion activates the pilosebaceous unit, and then there is a increase in sebum production. Then there is a hyperproliferation of the keratinocytes into the follicular unit. So that causes the plugging of the pilosebaceous duct, and that leads to formation of microcomedones, which are non-visible to your naked eyes. And these microcomedones are formed 2-3 weeks prior to the comedones which are seen on the skin surface. So there is a misconception when you see a acne lesion, it has appeared in next 2-3 days only. So sometimes people, they tend to blame certain things कि मैंने ये किया तो 2-3 दिन में मेरे को ये acne हो गया. But actually, the acne lesions has already started below the skin in the form of microcomedones, which are not seen on the naked skin with naked eye. So that is 2-3 weeks prior. And then the another risk factor is, so that is physiological, it's not a risk factor, but hereditary plays a role. If your parents, the child or the patients' parents, they had a lot of acne during their teenagers, then there is a tendency of them developing more of acne. Then lifestyle, the modern lifestyle. If you see, there are a lot of data which suggest that the acne proportion wise more common in urban setting rather than in rural setting and in our Adivasi areas. So there, even there is a role of diet. Though there is a two group of people, some people they believe in that, some people don't believe. But then, if you see the overall scenario, then I feel there is a role of diet in excess. If you have this junk food and high calorie diet, sugar containing diet, and dairy products, then get lead to acne, obesity, along with in females usually PCOD, which is very common in urban setting. Every few years back, there was a study in Mumbai. Every fifth girl or a female was suffering from PCOD. So that can also lead to more of acne, and that's why we are seeing more of adult acne. So usually acne occurs between 12 to 25, 26 years of age, but more and more people, especially females, they are getting adult acne beyond 26 up to 35, 40 also we are seeing acne. So most probably it is because of the lifestyle modification, the diet habits, and even stress. So, and certain drugs can also lead to acne. So these are the risk factors.
Yeah, I think this program is attended by not only doctors but even healthcare workers as well as people attend and see this particular program. It is very important that Dr. Devendra Jain has clear cut mentioned. There are so many risk factors which are even controllable risk factors, avoidable risk factors, where the predisposition of acne or exacerbation of acne can be also taken care by patient by taking a proper education. That is very, very critical. I think there are so many modalities of the treatment, but I think today our focus will be on oral antibiotics because among all the therapies, whether it is isotretinoin or topical therapies, topical retinoids, but very important therapy is antibiotics and oral antibiotics. So, what is the role of oral antibiotics in the overall acne management?
See,
Algorithm.
oral antibiotic is not the first line of treatment in acne unless the acne are really on the first visit. They are say inflammatory acne. Means there are a lot of inflammatory lesions like pustules and papules, and lot of inflammation is there. Then oral antibiotic is drug of choice, and in that doxycycline or tetracycline group of drugs play a major role. And here the role is not only antibacterial, here the role is also anti-inflammatory, because we give this therapy for a long time. So antibacterials usually you don't give for 8 to 12 weeks, but in acne, when you are giving doxycycline, you have to give it for at least 8 to 12 weeks. Okay, so that is the first thing. And another thing is, sometimes if the patient is having a history of acne, their parents is having severe acne and history of scarring, if you see them when they accompany the patient, then you don't want to basically you want to avoid scarring happening. So inflammation leads to more scar and pigmentation, that is the sequelae of the acne. So you want to control it them fast. So here the patient may have little mild acne, but then you want to treat it aggressively because you want to avoid the scar, since there is a genetic tendency. So there is a role of antibiotics, and especially doxycycline and tetracycline group play a major role.
Yeah, I think a very important point you have made is about inflammation because as you are also discussing that the comedown papule is seen outside, but the process of inflammation is going on for weeks below the skin. Right, so it is
Yes.
yeah. So that is very, very important. So I think acne as an inflammatory disease. What is your opinion? Is it a whole inflammatory disease?
Yeah, acne has actually four pathophysiological factors. Okay, so one is obviously this thing, uh, the pilosebaceous unit. In that there is a hyperkeratinization, and because of that there is a proliferation of keratin, turnover gets increased, and there is a follicular plugging. So that is one. Second is the sebum secretion increases under the influence of the androgens. Okay, so seborrhea is there. Third is colonization with the bacteria. So especially here there is Propionibacterium acnes, which is P. acnes, also known as nowadays Cornybacterium acnes, C. acnes. So that has a role, which is actually a commensal, but then because of that environment which is created over there because of the this plugging of the follicular unit and the accumulation of the sebum. So they proliferate more, and that leads to a lot of inflammation. That triggers the cascade of inflammation, and a lot of cytokines and these inflammatory factors are released over there, and that causes a lot of inflammation. So when there is a pustule which is painful, or when there is a papule which is painful, and there is a redness around that, obviously then there is nodule and all those things, these are severe, then it's a sign of inflammation. So we have to control the inflammation at its earliest, because the damage is caused by inflammation itself on the skin. Because treating the acne has two dimensions. Why we treat acne? One is it has a cosmetic implication, which is an immediate goal, because patient doesn't like, he gets psychologically disturbed, socially disturbed, his attention gets diverted, and a lot of other impact is there. Okay, but the consequences of the acne, which leads to the permanent damage like hyperpigmentation and scarring, which we want to prevent. So for that, you have to control the inflammation as early as possible, and for that, anti-inflammatory like doxycycline has a role.
I think Dr. Devendra Jain has very nicely talked about the inflammation, which is a underlying acne process, and which is not only leading to the lesions but also in the scarring, which is where he talked about that the scar formation is it is very essential that you have to control the inflammatory process. And doxycycline, I think it is well known for a good anti-inflammatory effect. And as an anti-inflammatory drug, it is used for febrile illnesses other than the acne also, because of pure anti-inflammatory benefit. Now you are elaborated on the duration. Again, you can tell it that for the all audience that what is the difference between antibiotic shorter duration and in this process of acne a long duration of antibiotics like doxycycline. Yeah.
See, actually, when you give antibiotics, we have seen you give not more than 2 to 3 weeks, even in severe infections. Ideally, you give for 5 to 7 days in mild to moderate infection, but in severe infection, you go about 2 weeks to 3 weeks. But in case of acne, when you are giving tetracycline group of drugs, you have to give it for at least 8 to 6 weeks, because the effect only starts at around 6 weeks onwards. So you don't see very immediate results, and you give here lower dose, which is known as the antibiotic antibacterial dose, say come dose we give usually in doxycycline also. So that also has a result and effect because of the anti inflammatory properties, not only antibacterial properties here.
And I think you may be using doxycycline in many different patients. So, are you using that with other drugs combinations and other oral drugs or topical drugs, and it works as a combination also very nicely?
In acne, yes, I use with topical combinations usually, not much of oral combinations, because in acne, if you see the other oral drugs which is recommended in severe form of acne is isotretinoin, and usually we don't combine both together in the same patient at the same time. Later on, we may switch over to isotretinoin once the inflammation is under control and the patient needs it, because both of them is supposed to lead to headache, which is this thing, and that is a side effect. Okay, and second thing is in combination topically, usually we use it with retinoids. Okay, so that is adapalene and tretinoin, and benzoyl peroxide also sometimes we use along with that. So these are the two topical drugs. I don't use topical antibacterial along with oral antibacterial, okay, because there is no rationale for that. And even if we use topical antibiotic in acne, then it has to be combined with either adapalene or benzoyl peroxide. It has been seen if you combine with benzoyl peroxide, the combination, then it gives you better results, faster results, and the chances of developing resistant to the topical antibacterial is very, very minimized. So plain antibacterial using in acne, I have given up for last, I think, 5 to 6 years now, because there is a lot of data which has suggested there is a lot of resistance been developed. Some places it has been shown 90 to 95% resistance to topical antibacterial, which is uh, clindamycin, especially because it is in use for many years now, decades, I think. And a lot of people use over the counter and misuse that, and they used to use it only antibacterial topically for acne.
I think this is the most important lesson Dr. Jain is talking about, is that the topical use of clindamycin or the antibiotics is really developing a risk of resistance. And over the counter, patients are taking clindamycin over the counter for acne before visiting the doctor. So in your practice, since you might be getting referred patients, they are already taking their own treatment. Some family physicians or consulting physicians have treated at some level, and then they are coming to you. So what kind of resistance pattern you are seeing, especially this topical? You already stopped the drug, but still.
See, usually I never use plain antibiotic, topical antibiotic, since many years I have stopped it. Even if I have to use, suppose when I say ki there is a mild acne where few lesions are, you see inflammatory and infection is there, then I use it in combination with either benzoyl peroxide and clindamycin, or with adapalene and clindamycin. So this is the way I usually treat the patient of mild acne. If the acne are little, say, moderate to severe acne or moderate acne, then I directly start with oral antibiotic like doxycycline. And topically, we give either adapalene or benzoyl peroxide according to the patient's profile, whichever is suitable to them and what is suitable in their day-to-day life. So that is how I deal with it.
Yeah, I think the point which is very critical is antibiotic resistance in the P. acnes or C. acnes, what we talk about, and the rampant use of topical antibiotics by own and for the time. I think automatically people go on doing that for years, and that leads to. But doxycycline has got a good property that because of the mode of action is totally different, and the additional anti-inflammatory benefit, the overall risk of resistance is going to be relatively less. Now, if you look at the patient profile, I think for these patients, the mirror also becomes an enemy, because patient gets some treatment, slightly is better, and again after 6 months he comes back. Again after 1 year he comes back with the same lesions. So in this kind of patients, again, are you repeating if you have already used doxycycline? Patient again comes after 1 year, 2 year with similar kinds of lesions. So are you going to
See,
use doxycycline again? What is your thought process in the
See,
practice?
actually, when a patient is coming to you for acne, you have to do a proper counseling. Acne is not a temporary treatment, as people understand it. It is a long-term treatment. I always tell the parents and the patient both, okay, there are three stages of treatment for acne. you know. First is you have to control the acne as early as possible, especially the inflammatory lesions. Second thing is to maintain the uh, whatever result you have achieved, so that you don't get acne again, because they are in that age group where, suppose a patient comes to me at 14 years of age, we know acne can occur up to 25, 26 years of age. So it's a long time to go. है ना? So maintenance is very important. You have to always keep on harping. Once the acne lesions disappears, that does not mean you stop your treatment. So there is a, like, the best thing for maintenance is topical retinoids. So you can only maintain with topical retinoids uh, for a long time. There is no side effect. And another thing is, if the patient suppose stops and they come back to us, and obviously if they have lot of inflammatory lesions, then there is no harm in starting doxycycline again, because it has helped you. And if there is a gap in between, then there is no reason I see you cannot start doxycycline, and I do start doxycycline again. But only thing is, I always tell my patient, we don't want relapse, so severe relapse again and again. So what is important is to be in touch with your doctor, follow the instruction for a long time, and continue the maintenance treatment. And at the first sight of flare, you should consult your doctor, so that it can be managed as early as possible.
तो एक्ने के साथ लड़ना एक बहुत बड़ी जंग है और यही
Yeah,
डॉक्टर जैन बता रहे हैं कि ये 15 या 16 साल के स्टार्ट होगा, बट 10-15 साल तक केयर लेना है. सो आई थिंक दिस इज अ वेरी वैलिड पॉइंट, is that even if the acne lesions disappear, and the patient, or I think young person, young adult, should not be become redundant and stop treatment. He should always follow the instructions of the doctors. It is very critical. And the other point which doctor has highlighted is that again the flare up happens, unfortunately, might be because of risk factor, hereditary, anything, or so doctor is going to give the same kind of a treatment which he has given in the first shot, so that the patient. So doxycycline also can be given after 1 year if there is some recurrence, or there is flare up of lesions, especially in mild or moderate cases, as it is critically mentioned by doctor. So I think acne care is a good patient perspective. It is very critical, as well as the doctor perspective. And doxycycline is going to be a very, very good friend in the management of acne. There is another element, acne. I think there is a small component called acne rosacea. Relatively, if you see incidence wise, it is much less than acne vulgaris. But is there any role of doxycycline in this acne rosacea?
Yes, yes, sure. Acne rosacea actually is little different from acne. It usually involves the central face mostly, and there is erythema, lot of redness is there. Second is there is telangiectasias, the superficial vessels start visible. Then there is a history of flushing. Sometimes, patient says they feel warm and red, and that is transient. It appears and it disappears. And there are always some trigger factors, and that varies from person to person. So you have to tell the patient you should find out what are the trigger factors for you when your acne rosacea flares. And acne rosacea is not limited to teenagers or up to 25 or 26 years of age. It can last even in adult and mid adult life, up to 45 50 we have seen. And if it is becoming chronic and long standing, then it has its own permanent damage on the skin. So doxycycline, obviously, when there is, it has an anti-inflammatory role here also, because there is a lot of inflammation, redness. So doxycycline is one of the drugs. If there is a mild rosacea, we usually deal with topicals like metronidazole, then very mild cleansers, then sun protection, because UV rays and sunlight is one of the factor which triggers rosacea. Another factor is stress. Then sometimes some diet habits like excessive coffee, chocolates, aerated drinks, and all those things can also flare acne rosacea. So you have to counsel the patient and accordingly find out. Another thing is mild cleanser is very important. Sun protection is very important. You can give them physical sunscreens when they are going out if the patient has a job where he has to be outdoor for a longer time. And
Yeah, I
obviously,
think this,
oral doxycycline has a role.
yeah,
Yes.
so I think oral doxycycline also has got a role in acne rosacea, as Dr. Jain is clear cut mentioning. Slightly different than acne vulgaris lesions, but it is also a form of acne which we see in the practice. Now we have seen that the use of doxycycline for so many decades. One of the reason is that it's a very beautiful pharmacological molecule. Oral dosing is there. Tolerability wise, also relatively very good. The chance of GI tolerance with the other drug category of drugs like amoxicillin, penicillin group is very problematic in today's scenario also. But I think doxycycline has got a well tolerability, and it is lipophilic, because that benefit in acne is also it
Yes.
has got a lipophilic nature beautifully. So acting on the inflamed as well as non-inflamed lesion. But we have seen all different kinds of infection treated with doxycycline. Respiratory tract infections are treated very nicely. But there was one element is like sexual transmitted diseases. I think there is a when you maybe there in the KEM there was a separate clinic on sexual transmitted diseases at that particular period of time. So, what is the role in now current practice in venerology also, that the doxycycline usage in certain cases?
Frankly speaking, actually, if you see sexually transmitted disease nowadays, what we see, most of them are viral diseases now. Okay, we
Yeah.
don't see syphilis, gonorrhea, or chlamydial infection that often what we used to see when we were student. Okay, maybe I don't know the reason. Maybe it is rampant use of antibiotics in the society, or people. Uh, I mean, or at the family physician levels only they treat them. I don't know. But then most of the lesions which most of the conditions which we see in sexually transmitted disease nowadays is viral. So there is no role of doxycycline in viral infections. So what we see is herpes, then we see this thing, condyloma acuminata, which is again a viral wart affecting the genitals. Now, recently I saw very after long time a case of secondary syphilis
Okay.
in a lady. Okay, and it was a very interesting case. At the first visit, actually, I missed the diagnosis, and later on, somehow I I just it just clicked me ki the presentation is looking like, because nowadays these things have become so rare ki you don't usually see it so commonly. So it doesn't click to you at the first instance. And then we did the investigations. VDRL TPHA came highly positive in high titers, and I obviously, as the first line of treatment, I prescribed uh, penicillin group like Penidura, but unfortunately, it is not available nowadays. So obviously, the
Yeah.
drug of choice was second line is treatment is always tetracycline group, and doxycycline is the drug of choice. So I have put the patient on doxycycline, 100 milligram BD on empty stomach. And after 10 days, I visited. The follow up was there, and a lot of lesions have improved, and she has improved quite a bit. So obviously, doxycycline has a role in syphilis. Then you have a role in chlamydia infection. Then you have a role in non-gonococcal urethritis. Uh, uh, Again, you have a role uh, in gonorrhea also. Suppose the patient is not, sensitive to cephalosporin third generation, and so you can give along with to prevent the non-gonococcal urethritis, because most of the times gonococci they respond, but then the patient keeps on getting that symptoms. So mostly that is non-gonococcal urethritis, and you can give that. And in females also, chlamydial vaginitis and proctitis and uh, all these things are treated with doxycycline. Yes.
Yeah, I think you have mentioned right that many times these physicians as well as the family physicians, they treat this kind of the initial presentations of sexually transmitted diseases and the use of antibiotics there at that level. So I think since the program is going to be attended by many doctors, it is very essential that doxycycline has got a good role in sexually transmitted disease of various forms, as Dr. Jain was mentioning in the primary settings. The incidence is relatively less, there is no doubt about that. But nowadays there is a concept like in malaria we give doxycycline as a prophylaxis, especially those who travel from one place to another place. Now in HIV also, for preventing certain infections, the prophylaxis is given. So is there any scope of prophylaxis in STDs or any other diseases in the dermatology practice with
No, I have
doxycycline?
not. No. I have not practiced any prophylaxis with doxycycline in preventing STDs in my practice at least. So I'm not aware of it.
Yeah. So I think right. So it's basically the malaria is one of the important area where the doxycycline is used as for prevention purpose. And here the major role in acne as well as sexually transmitted diseases or acne rosacea, it is the whole treatment part. So overall the discussion is going on very well, sir. For acne patients, any message you want to give as a dermatologist? It is very important that it's very distressing because the stress leads to acne, acne leads to stress, and there's a vicious cycle going on. And
See,
the patient is not it's there are more than, I think, physical. It's a lot of emotional and quality of life is affected, marriage issues, then peer to peer interactions is affected, so all those factors. So any special message you want to give for acne patients? Yeah.
See, basically, acne is earlier it used to be known as only cosmetic issue, but now a lot of studies have revealed this. Ki it has a lot of psychosocial impact, and the quality of life get affected. And people who are suffering from diabetes or heart diseases, so the emotional impact of acne on the person who is suffering is equivalent to people who are suffering with diabetes and heart condition. But many a times what happens, the parents and the generation before the patient who is affected now, they take it very lightly, and they try to say we हम लोग को भी टीनेज में हुआ था, ये तो जवानी की निशानी है, डोंट वरी, जब एक टाइम आएगा आप उस उम्र के हो जाओगे तो आपके एक्ने ठीक हो जाएंगे. But nowadays the generation is different. They see everything in different perspective. A lot of the potential job perception, job opportunities are depending on your personality, on your looks. There is service sector which is growing, and people want to join that service sector. So they want to obviously look good, so that their personality is like that, and they are confident. So the my message is, don't ignore acne. One, second, don't self treat. That is another thing. No home remedies should be done. Okay, with the help of your friends, relatives, and your parents or नाना नानी दादा दादी का नुस्खा अपने चेहरे पे ना अपनाएं, because उससे ज़्यादा harm होने की संभावना है. And you waste that precious time. So always consult your dermatologist, whoever is nearby you, and get acne treated professionally according under his guidance, his or her guidance. That is very important. And continue the treatment as they advise. I already told acne has 3 phases of treatment, 3 steps of treatment. First is to contain acne as early as possible. Second, to maintain that containment. And third is to treat the sequelae of acne. So these 3 steps are very important. You have to keep patience. Acne treatment takes time. It takes few months. It is not, and sometimes the maintenance treatment can last for years, so that you prevent flares again. Okay, so it is not a treatment for a few weeks or few days or like that. So that's all. And you have a good lifestyle, no vices like smoking, alcohol, healthy food, stressless life. Avoid stress, do some meditation, have healthy food, some exercises. So this is all important. I tell my patient according to, about the food. Like a lot of time the parents, they ask us what food. Then I tell them, what जो आपके दादा दादी खाते थे, start eating that. That is
Yep.
important. So if you want to take your advice from Dada Dadi, then take about food. So they never used to have pizza and burgers and all those things. So have homemade food, healthy food, a lot of greens. 40% of your food should be raw. So fruits and salads and vegetables should be part of your day-to-day diet.
सो एक्नी वल्गारिस हर कदम एक नई जंग है और आपके साथ है डॉक्सी. I think it's a good talk about doxycycline having antimicrobial role, anti-inflammatory role, being a lipophilic. The studies have shown that it reduces the inflamed as well as non-inflamed lesions. It induces less resistance, which is very very important for managing acne, and it doesn't affect the normal skin flora. And pharmacologically very beautiful molecule, and we are using for so many decades. So I think this is a very nice talk. I think I really patients as well as the doctors have got a lot of practical tips. So I really thank Dr. Devendra Jain for this particular doxy talk.
Thank you.
All the audience, I think this is a very scientific dissemination show. Dr. KK Med Talk. This episode was 375. The partners are IJCP, Heart Care Foundation of India, and USV. So attend these shows, Dr. KK Agrawal's, learn and practice. Thank you.
Thank you. Namaste. Take care and be safe.